It's an opioid.
It's an opioid. And the reason she's getting it is
For her pain.
Okay, so next question. Is 4 milligrams a safe dose? Okay, did IV push? Yes, both of those are correct. So you take a little check mark and track it there. And what are the side effects and the nursing implications for this particular drug?
Decreased respiration, so we'll need to know what a respiration is.
Okay, so
With extended use.
let's ask about vital signs and say we need to know vital signs. And so what we're going to get now is we're going to get a tenth of 100, and we're going to get a heart rate of 86. We're going to get a respiratory rate of 14. We're going to get a blood pressure of 140 over 90. And we're going to get a SAT of 98 on rim air. Okay, so we've got information that we need. You can always ask them if the information is not provided. Based on this, we can give it because it lowers the respiratory rate. What else does it lower? What else does it decrease? Consciousness, yes. Blood pressure, yes, both of those. So what are your nursing implications there? What are you going to tell them to do? It seems simple, but this is what you got to do. Fall risk, right. Tell them to sit on the side of the bed. Tell them to call you if they need to. That's right. What's the rate of administration for morphine? Gayheart. Come to me, Gayheart.
Is it over 2 minutes?
Is it over 2 minutes? A little longer than that. It's usually 4.
2 to 5?
It's 4 to 5 minutes.
4 to 5.
The rate of administration is 4 to 5. Okay. So does it need to be diluted?
Yeah, so I can give it slower.
Okay, so Andrea is given the right answer, which is Gayheart says no. It doesn't have to be diluted. All right, so now we're going to have to enter something else. Let's go ahead and get compatibility, and we're going back to dilution. Is it compatible with normal saline and the KCl? Because both of them are in the back. On saline, yes, okay. And what if you can't find the KCl? If it's compatible with the KCl, what you gonna do? KCl, yes. If you couldn't find it, then you would call the pharmacy and ask. You also are given this push, so you can push before and after with the normal saline and make sure that the line is okay, because that way. Okay, so let's go back to dilution now. Yeah, that's exactly right, Stuart. So let's go back to dilution. Can you, what do you got to find out before you can go to dilution here? How about we need some concentration, don't we? What's available is 8 milligrams per ml. So we got 8 milligrams per ml of morphine. So how much are we giving? 0.5. Okay. 0.5. Can we give 0.5 over 5 minutes? No.
No.
Well, not in the 10 ml syringe for sure. So what we're going to do is, yes, we're going to dilute it. What else do we have to use? I just said it, but what else do we have to use on this one since over here in the IV column, we got this little bit of information which is very important. Yeah, you need
Sterile. Sterile saline?
Well, it's normal saline. It's sterile, but it's normal saline. You're mixing up, I think, in your head sterile water and normal saline. So let's.
Going in a central line, so it needs 10 ml.
It's right. It needs a 10 ml syringe. So that's the driving force here. 10 ml syringe time. So sometimes you have to dilute medicine. It doesn't. This book says it doesn't have to be diluted because you got to give it over a certain time frame, and you have to use a 10 ml syringe. So that's important. That's really important. I'm gonna give you all a round of applause because we've got 36 people here right now, and that's amazing because that means y'all want to pass. You're ready to get out of here. Okay, let's go on to Cipro. We're doing the same thing. Don't take any shortcuts. We're ready to do this. The other reason I don't want you to take any shortcuts is because I might be the person laying in the bed, and I want you to do it right. So when I'm looking up and you're looking down, you're going to take care of going to the right. So let's see, we got time. 0900 for the Cipro. And the med is Cipro. Okay, so I need to know a class for Cipro.